I remember some science fiction writer, I don't know who, once had said, any technology sufficiently far advanced will appear to be magic. And to me, in many ways, this machine is magic. There's a fully functional, very high-speed computer that's controlling everything. I mention this because there are some small systems that are much, much less powerful, that are not really fully functional computer systems. And so that's the difference. You have something magical under the hood, being the ability to run the most complex algorithms which you need to be able to evaluate tissue features in real time as you're seeing it. I've been using the equipment for a little while now, and it's as general in usage as all of ultrasound. Now, most people are familiar with ultrasound from obstetrics, and this has become a worldwide phenomenon. But of course, ultrasound has uses in almost the entire body. Anything except bone and except lung. Otherwise, you have whatever you want to look at. And so we've been using this in general medicine, pre and post-operatively for surgery patients, gynecology, obstetrics, of course. And there are special areas like endocrinology to look at glands, particularly the thyroid gland, to look at breasts. A big area of interest now is screening women for the very earliest signs of breast cancer so you can begin therapy when it will work very well. And I find that the U-Lite is a marvelous instrument. It has superb image quality, which lets me do very precise diagnosis, but it's so small you can carry it anywhere. I've realized something that's very basic, and that is it doesn't matter where in the world you are. I mean, we talk about what is French, what is English, what is American, but in terms of health and medicine, this is a universal issue. All around the world, doctors have one goal. Patients have one goal. Patients want to be healthy. Doctors want to help them to be healthy. So it doesn't matter where you are. The goal is absolutely identical everywhere, which is why some people used to think of medicine as a big fraternity. It is. We are the same. So in that context, yes, I've been doing things in America, but I also think I could be doing this someplace else. I think the future of ultrasound is easy to predict, especially if we look at its history. The earliest machines, very big, showed very, very little, but the information was still uniquely valuable. So now we have devices like the U-Lite that give you images with incredible amounts of detail that tell you a lot about actual disease and tissues, not just as an organ present or not. And it is so small, you can bring it anywhere. You can bring it to the bedside of a sick patient. You can take it to a clinic that is in the remote jungle if you need to. So you have the advantage of the very best diagnostic information and portability together. For the patient, the issue is that the traditional way of doing things is first you take a history to ask people what their problems are, and you try to decide what category of disease they're in, and then you do a physical examination. You may listen, smell, look, and then you have some laboratory studies to confirm what you think is wrong. And the difficulty with this is that this is very, very insensitive, so that you can only find very advanced disease. It's no good for finding beginning disease. A disease may be like diabetes, will be developing for 10 to 20 years before it begins to show up, so it's identifiable by traditional methods. So from the patient standpoint, you want your doctor to be able to do the physical examination of now, not the physical examination of 1820. And with that, the U-Lite brings you the advantage of, in all fields, of the most advanced kind of physical exam, the most sensitive physical exam that you can do by supplementing your own senses with ultrasound.